All right, well, I'm going to go ahead and just get started. Well, this year's flu season is off to a very strong start, with flu activity high and still increasing across the United States and Ohio. We're seeing many more people come down with the flu than is typical, and we're also seeing more people become very sick, including more people ending up in the hospital. Indeed, our most recent data for the week ending January 3rd showed us that we had 1,911 patients hospitalized for flu in Ohio this flu season, which is up even from last year, which was a particularly significant or severe flu year, when at the same time last year we had 1,305 hospitalizations ending the week of January 4th. So as you can see from the graphic on the screen, a spike in cases this time of year is not at all unusual. It's really to be expected. And last year, as I said, we had a pretty severe year of flu, and we had several weeks in the month of February when hospitalizations actually topped 3,000. Could you get me some water? Sadly, we've also had this season's first pediatric death from flu-related illness, a teen in Greene County. In Ohio, we typically get about 1 to 8 pediatric flu deaths in Ohio. Our death, sadly, this first death was a teen in Greene County, and our hearts go out to the family. Now, we're hearing a lot about a new strain of the flu, which has been dubbed by some the super flu. And I want to talk a little bit about that. This new strain of the flu is a type of influenza A, technically referred to as H3N2 clade K. Because it's a new strain, most people in Ohio have not encountered it before this flu season. And we face it, therefore, with relatively little immune protection. And this lack of immunity in our population is allowing this strain of the flu to spread quickly. So more people are getting sick, and more people are also landing in the hospital. So who is getting the sickest? What we're seeing across the country is that children, especially those less than 11 years of age, and older adults, especially those over 65, appear to be at the greatest risk of getting very sick. But that is not because this new strain of the flu has an enhanced ability to make people sick. The issue is that we just have more vulnerable people who are getting infected in the first place. And with more people overall getting infected, we're also having more people get very ill and needing hospitalization. Now, because this is a new strain of the flu, there's also been a lot of concern expressed in the public and in the media about whether this year's flu shot is any good. Well, it is good, but it's not very good necessarily at keeping you from getting sick in the first place. It is good, though, at helping you be protected from becoming seriously ill and potentially ending up in the hospital. Look, whenever the circulating flu has changed fairly recently, and it changed significantly from previous versions, as this strain has, it's pretty typical that the flu shot may not be as good at preventing you from getting the flu in the first place. And by the way, I don't have the flu. I think the air in here just feels very dry to me. Nope. Yeah. Oh, okay. Oh, and starting all over? Well, hopefully you guys don't mind me doing that, but yeah, I'd be happy to do that. All right, here we go again. Well, this year's flu is off to a very strong start, with flu activity high and still increasing across much of the country, and of course also here in Ohio. We're seeing more people than usual getting sick with the flu and also more people ending up in the hospital. Indeed, our most recent data for the week that ended January 3rd showed that we had this flu season 1,911 patients hospitalized here in Ohio. And that's up even from last year, which was a more severe flu year itself. When we had 1,305 hospitalizations in the week that ended January 4th, 2025, so the same time period in the previous year. Now, as you can see from the graphic on the screen, a spike in cases this time of year is not at all unusual. In fact, we expect it. Last year, as I said, we had a severe flu season, and we had several weeks in February where hospitalizations topped 3,000. So the pace that we're at so far this year certainly points to us potentially
Okay,
having the
I can
same
take your
sort of
5:30
scenario,
info, James.
the same sort of scenario this time or in February of this year. Sadly, we've also seen this year's first pediatric flu death. Sadly, this was a teen in Greene County, and our hearts go out to that family. In Ohio, unfortunately, we typically see between 1 and 8 pediatric flu deaths each year. Now, we've heard a lot about this new strain of the flu that many have dubbed the super flu. And it is, in fact, responsible for this uptick that we're seeing. So, what do we know about the super flu? Well, it's a new strain of influenza that is technically an influenza A known as H3N2 clade K. Now, because it's a new strain, that means that most Ohioans are coming into this flu season without much in the way of protection against this strain of the flu. We have very little background immunity as a population, and this lack of immunity is allowing this strain of the flu to spread quickly. So we're seeing more people come down with the flu, but we're also seeing more people get very sick and sick enough in many cases to require hospitalization. So who are we seeing getting more sick? Well, what we're seeing across the country is that children, especially those less than 11 years of age, and older people, especially those over 65, are the population that seems to be at most at risk for getting very sick and sick enough to end up being hospitalized. But this is not because this new strain of the flu has developed any special ability to make people really sick. The issue really is that we simply have more people coming down with the flu, more people vulnerable to the flu, and with more people overall coming down with the flu, more people are proportionately ending up in the hospital. Now, because this is a new strain of the flu, there's also a lot of concern about whether this year's flu shot is any good. And I can tell you it does appear to be good. Now, it's not very good at protecting us necessarily from contracting the flu in the first place, but it appears nevertheless to still be good at helping to prevent your flu illness from becoming very severe and potentially landing you in the hospital. Look, whenever the circulating flu has changed significantly from what we as a population have been used to seeing, it's pretty typical for the flu shot to not be as good at preventing people from contracting the flu. Nevertheless, experts agree that this year's vaccine still helps protect you against severe illness, including hospitalization and death. Remember that even in years when the vaccine isn't a perfect match, as is the case this year, it usually still reduces people's severity of illness. Indeed, we have early data from the United Kingdom that suggests that this year's flu shot is very effective for keeping kids out of the hospital and moderately effective for keeping adults out of the hospital. And that's why health experts, including me, are still strongly recommending that you get a flu shot if you have not already. And it is not too late. Flu season continues through the spring, and although the shot is most effective about 2 weeks after you get the shot, there is still plenty of time, and the sooner you get it, the sooner you're going to be protected. Now, in Ohio, it's estimated that about 37.5% of children have been vaccinated, and that's slightly down from last year, this time, where we were more around 39.5%. On the other hand, adult vaccination appears to be a little bit ahead of last year, around 41.3%, and this year around 47%. That's up from 41.3% last year. So, what should people do? And the first thing is get vaccinated. It still is your best protection. The next thing is practice good hygiene. It's really important to wash your hands regularly. Cover your cough or sneeze with your elbow or a tissue, and avoid touching your eyes, your nose, your mouth. That's a great way to help reduce the likelihood that you're introducing bad bugs into your system. The third thing is, if you feel sick, stay home and remain home until your fever has been gone for at least 24 hours. I also encourage people to clean and disinfect frequently touched surfaces regularly. And on warmer days, like we're having here in Columbus today, crack your windows. It's nice to get some fresh air into your environment. And finally, if you do feel sick, please reach out to your doctor immediately to see if you are a candidate for one of the antivirals like Tamiflu, remembering that those medications have to be started within the first 48 hours that you are experiencing symptoms. Now, I want to move to a different but somewhat related topic, and that is the recent vaccine schedule changes introduced by the CDC earlier this week. Now, I've heard a lot of confusion about this, and so I'd like to take a moment to try to summarize what's new and what is essentially the same in these new guidelines compared to the previous. First, it's important to understand that key portions of the new CDC vaccine schedule have in fact remained essentially unchanged. Indeed, the CDC made no change or only changed the number of doses for 12 important vaccines, and those include the HPV vaccine, which did have the number of shots reduced, the RSV vaccine, the DTaP and Tdap vaccines, which are designed to cover diphtheria, tetanus, and pertussis, the Hib vaccine, which covers Haemophilus influenza B, the pneumococcal vaccine, the polio vaccine, the MMR, which covers measles, mumps, and rubella, the varicella vaccine, which covers chickenpox, and the meningococcal B vaccine. And finally, the dengue vaccine, which is actually reserved for areas of the world that have dengue endemically, which for the United States is Puerto Rico and the U.S. Virgin Islands. So not something Ohio parents would be accustomed to hearing about. So it's a list that interestingly aligns pretty well with the longstanding list of vaccines that are required for school here in Ohio. So what's changed? Well, first, the meningococcal vaccine for teens, which is called meningococcal ACWY, so different than the meningococcal B I mentioned before, it is now recommended primarily for high-risk groups, but importantly, that continues to include first-year college students who are living in residential housing. So that really means that any high school student in Ohio who's contemplating going on to college and potentially living at college really needs to get vaccinated. There are 5 vaccines that are now left to parents to discuss and decide on with their child's doctor rather than having a specific recommended schedule from the CDC. And those include the vaccine for hepatitis A. Hepatitis A causes a transient disease of liver inflammation. The vaccine for rotavirus. Rotavirus causes severe diarrhea, especially in young children, and can land them in the emergency room or the hospital. And the vaccines for influenza, hepatitis B, and COVID, which are vaccines that either I've addressed in my comments today already, or in the case of hepatitis B and COVID, which I addressed at my conference last month. But very important, I want to underline that no one is saying that your child can't get any of these vaccines, nor that these are not good vaccines. They are good vaccines. And pediatricians almost certainly will continue to recommend these vaccines to their patients, and insurance companies are still required to cover them without cost sharing. So, as in the past, I recommend you look to your child's doctor to help you decide which vaccines your child needs and when they need them. You know, all the controversy swirling around this issue has unfortunately obscured a very, very important point around which I believe there's a pretty broad consensus, and namely that the pediatric vaccinations have always been intended and therefore should always occur in the context of an informed parental decision. Parents should understand what the protective benefits are of each of their child's vaccines, as well as what the potential side effects are before they choose to vaccinate their child. And your child's doctor knows your child's individual healthcare needs the best and is well situated to help you and guide you in making the best decision for your child. And as the director of the Ohio Department of Health, I want to reiterate that I have the utmost confidence in the safety and effectiveness of all of these vaccines and in the professionalism and competence of our pediatric providers all across our great state. And with that, I'd be happy to take questions and drink a little bit of water.
Are you worried that this is just the beginning and hospitals could get overwhelmed if those numbers do go up and people don't heed your warning of getting that vaccination?
Well, one of the reasons that I shared the numbers and shared the graphic is because it is almost inevitable, given where we are at this moment, that we're going to see a continued rise as we go into February. It's the usual pattern. So it is worrisome that we could see the very high numbers of hospitalizations that we saw in February of last year be even higher this year. And that does put a real strain on healthcare delivery. But more important than the strain on the hospitals, which is very real and of great concern to me, far more important is the impact that the flu will have on the lives of all the Ohioans who, in fact, end up in the hospital. And so my goal is to do everything I can to reduce the potential for that suffering. That's the reason that I'm encouraging Ohioans who have not gotten the flu shot to go out and get it, because I think that we have a very good tool at hand to help mitigate against our risk of becoming severely ill with a flu that is very clearly spreading very rapidly.
With this flu spreading rapidly, is there any concerns for a peak in hospitalizations earlier than the same time last year, that late February? Or do we think it'll follow that trend, just be higher peak?
Yeah, it's really hard in any given flu year to predict how that year's flu is going to behave, but the past is generally a pretty good guide. And we do every year see this typical pattern of an early January rise in flu leading up to a peak sometime in February of hospitalizations. What's alarming is that last year was a pretty significant year compared to other years in Ohio for flu and for hospitalizations. And this year is already off to a faster pace.
So with flu no longer having are you concerned about, I know you said that you don't see this as a great deal of change, the CDC change, but if flu is no longer kind of has this blanket pediatric recommendation, you expect to see rates go down among people?
Well, it's a good question. I certainly hope not. And one thing that really is encouraging to me is looking at some of the flu vaccination rates that I shared earlier. We are seeing Ohioans who have now, over the course of a couple of years, heard various things in favor of and things questioning the value of vaccines. And yet, vaccine confidence is strong enough that our numbers generally are looking pretty good. Now, we've got lots more opportunity because still the majority of Ohioans have not gotten their flu vaccine. But I'm encouraged. The other thing that encourages me is that I know that parents, in making decisions about their child's health care, really do trust their child's doctor and really are engaging in meaningful conversations with their doctor about what's best for their child. And so I'm hopeful that that strong doctor-patient relationship will continue to guide parents in making the best decisions for their kids. Oh, I'm sorry. Yeah. So looks like the first one is Kevin Delaney.
Yeah, Scott.
Okay. I'm sorry. I guess Scott will
Yeah,
field
so
that.
I have Dr. Vanderhoff. All right, our first question is from Tanya O'Rourke. From
Okay.
Okay, hi, doctor, can you hear me?
Yes, I can.
Okay,
Yeah.
great. Thank you for doing this. So listen, you talked about the flu vaccine. It does not protect you from getting this new strain of flu, but that it will prevent you from getting very, very, very sick. How, to help people understand that, how do we know that that's actually the case? What makes you believe that to be true? And then also, does Tamiflu work for this new strain?
So those are good questions. So first, I'd say that what we believe, just looking at the data in terms of the number of people across the nation and here in Ohio who are contracting the flu, is that the vaccine does not appear to be as good at protecting you from acquiring the flu as perhaps we've seen in other years. It doesn't mean it doesn't work at all in protecting people from getting the flu. But the encouraging information that we have is real time data and information. In this case, that has emerged from the UK, and I believe was first reported on by folks at Johns Hopkins, that has pointed to the flu vaccine that we are using still doing a very good job at helping to protect children from getting so sick that they end up in the hospital, and for adults doing a good job at protecting them from getting so sick they end up in the hospital. So we have real life data that is reinforcing a pattern that we have seen many times before when there's a so-called vaccine to virus mismatch. And that pattern is that it may not do as good a job at keeping you from getting sick in the first place, but it seems to do a pretty good job of keeping you from getting severely sick and ending up in the hospital.
I'm sorry, what about Tamiflu? Does it
Oh,
Tamiflu?
yes, yes, it does appear. So at this point, all indications are that Tamiflu is effective. Recognize that Tamiflu has an entirely different mechanism of action and is not a preventative; it's a treatment. And yes, it does appear to be effective.
Okay, our next question is from Celia Hack with Signal Cleveland in Cleveland, Ohio.
Hi, doctor. Thank you so much. Can you hear me?
I can, yes.
I wanted to ask, I spoke with a pediatrician who in Cleveland who told me that she's seen more children in the hospital for flu this year than in years past. Is the state
Yes.
seeing a similar trend, and what can you speak to with regards to this year's flu's impact on kids?
Well, it's still early, but I do not have at hand the pediatric flu hospitalization numbers as a subset of the numbers I shared earlier. However, we do know from national data that children, especially under the age of 11, do appear to be at particular risk of becoming severely ill and needing hospitalization. So that is a pattern. What the doctor has anecdotally observed is consistent with what the national data is pointing to.
Thank you so much.
Okay, our next question is from Samantha Hendrickson with the Columbus Dispatch.
Hi, doctor. Thank you. Can you
Hi.
hear me okay?
I can, yeah.
Okay, great. So in previous press conferences, you've expressed concern about declining kindergarten vaccination rates. And
Yes.
given the revised recommendations, is a continued decline a concern for your office? And how might your office be discussing that topic or preparing for it?
Well, it's a good question, but it's speculative. I really can't see into the future quite that well. What I would say is this: our message continues to be the same, and that message is first one of confidence in the safety and the effectiveness of our vaccines at preventing a whole range of very bad illnesses. They all do a really good job. But the other message is we really do support the importance of an informed conversation that goes on between a child's doctor and a child's parents about their child's health needs, and what vaccines are best for their child and at what time. And I am hopeful that because of the strength of the relationships that exist in our state between children's healthcare providers and children's parents, that we'll continue to see the kindergarten vaccination rates improve here in Ohio.
Okay, and then our final question is from Gabriel Enright from WHIO TV.
Yes,
Hello, doctor. Can you hear me okay?
I can. Yeah.
Okay. Unfortunately, our area had the first pediatric flu death in Greene County, and I was wondering if there was anything else you could speak to that case. And then also, is there any data or any reason that people in the Miami Valley should be even more concerned about flu because we did have that first death in our area?
Well, what I would say is that it is a reminder to everyone in your area, just as it is across the state, that flu is a serious illness. And sadly, every year, too many Ohioans die from the flu. And indeed, some of those deaths, as I noted before, are going to include our children. Flu is to be taken seriously. We have a tool at hand that the data tells us is a good tool for helping shield us, protect us from becoming severely ill and potentially dying, and that is the flu shot. So my message would be the tragedy of these deaths reminds us that none of us are impervious to the effects of the flu. All of us are vulnerable. All of us need to do what we can to protect ourselves. Flu shot plus all the other tools that I described before, including good hand hygiene and thinking about the air quality, et cetera.
Thank you.
You're welcome. All right. Well, thank you very much. I really appreciate your time. Appreciate you getting me some water.
Recording stopped.